So when we rinse, we want to make sure that we're rinsing off not just the basic general parts of our hands that we think of, but that we're also paying attention to rinsing between the fingers and also on the wrist, particularly the backs of the wrist. A
Mm.
lot of times people forget about that. And then what happens is soap residue stays between the digits or lies on the backs of the wrists. And then people over time will get an irritant dermatitis from the soap residue that's there. And for little kids especially, it kind of can start to feel sticky. And people might think that the skin is dirty when it's not really dirty, it's simply soap residue. When we dry our hands, let's make sure that we're gentle to our skin. We can use a paper towel if we'd like, but that can be abrasive. So since we're doing a lot of frequent hand washing, it's important to pat dry instead of scrub dry. And I would suggest using a linen, such as a cotton towel, over a paper towel. But using a paper towel or a cotton linen is much more preferable to letting the hands air dry, as air drying only lets the skin dry out more due to diffusion and evaporation
Mm.
of moisture off the skin. And then if you shake your hands dry, first of all, you might make other people wet around you or contaminate surfaces. And then if you happen to have any sort of germs left on your skin accidentally, the vigorous shaking can cause the germs to distribute. Your skin is sort of like a kitchen sponge. And over time, with repetitive washing and using it with use, it will simply dry out and look like a dry kitchen sponge. And so when you wash your hands and pat dry, you do allow some moisture back into the skin. And then we like to trap that moisture by putting on a moisturizer, which allows it to be kind of like a happy, moist kitchen sponge. And there are multiple ways to do that. You can do that with lotion, with creams, or with ointments. Lotions tend to be the weakest of the three, if you will, with regards to moisturization because it has more water content. And so it goes into the skin quite well. It tends to be thinner, but it will evaporate faster. Creams are like lotion, but have less water content. So they tend to be thicker and they tend to take a longer time to absorb into the skin, but then they tend to stay longer and evaporate more slowly over time. Ointments purely sit on top of the skin. So you can think of them like a greenhouse roof or like a lid. And what they do is they essentially just prevent or slow the evaporation that naturally happens off of the skin. And what the warm water and vinegar soak does is it adds more moisture to that greenhouse effect. The vinegar helps adjust the pH, which keeps the skin clean. The heat or the warmth allows the pores to open up and allows the extra lotion that you've applied to soak deeper into the skin more effectively. And then you simply allow that wet dressing, if you will, or my nickname, the hand burrito, to be placed on overnight if you're sleeping, or for an hour during the daytime when you're awake. Zinc oxide is the white hypoallergenic chemical that's in unscented diaper paste, like A&D ointment and things like that. And it's readily available over the counter, and it's very inexpensive. And it has very nice anti-inflammatory properties. And what you can simply do is pretend that you're a 1970s lifeguard and put a thin layer of the unscented zinc oxide across your nasal bridge, behind your ears, or under your chin in places where the mask will rub, and then apply your mask. And that serves as a nice barrier to the friction without impacting or decreasing the effectiveness of the mask. And then when you take the mask off, once you get home, you can wash and then moisturize again.